Hello, everybody. My name is Julia Sloan.
We're so delighted to welcome Professor Julia Sloan. Could you introduce a little bit about yourself?
Sure. My research, practice, and teaching area is strategic thinking. And specifically, I look at how leaders learn to think strategically.
Could you tell us about any thoughts or insights on how that specific area can be related to nursing from your perspective?
Sure. When I look at nursing leadership development in the aftermath of COVID-19 from a strategic thinking perspective, there are many opportunities, and I'll mention two in particular. First, there's a need to move beyond strategic planning and engage in some very rigorous strategic thinking, and these two things are very different. Um, this means that nursing leaders will need to go beyond skill development and grapple with identifying and challenging the underlying assumptions of some current nursing operating principles. For example, some of these questions and principles that really need to be challenged are: what are the key operating principles today? And why are they considered key? Where did they come from? And are these operating principles as relevant today as they were when they were first established? Another example is for nurses to ask, what does it mean to be professional versus being a support staff or a technical assistant? And another thing to really begin to challenge and ask within the profession is for nursing leaders to identify and challenge some of the current boundaries of nursing. For example, what can nurses do and what can't they do? And to ask the question, are nurses simply mini doctors? Are they subordinates of whom? Are they possibly partners with whom? And why do these boundaries exist? And are any of them changing? Why or why not? What's the role of technology in redefining these boundaries? And also to ask, what were some of the boundaries in the past? And what could some of the boundaries possibly be in terms of the future? What are some of the consequences and what are some of the impacts? And what are some of the benefits to having these boundaries to nurses themselves, to doctors, patients, communities, and countries around the world at large? I think that nursing leaders need to learn to look at problems from a broad perspective, to see a problem from many different points of view, and to quickly change their vantage point. I think this is really an important skill to develop. It's important to look at other industries and also to look at other professions for cues, and to be able to look around the world at what else is happening. What other sorts of operating principles are nurses using in other countries? This ability to zoom in and zoom out can really lead to repositioning of a problem. And in that respect, technology is really a gift. So these are some starter questions that I think can help nursing leaders begin to broaden their scope and to begin to think more strategically about these critical problems.
Thank you for this. And you've mentioned that you had a second area to address. Could you talk about that area?
Mhm. Sure. When I look at nursing leadership development in the aftermath of COVID-19, I think that nursing leaders must also learn to deal with complex problems, not just complicated problems. Now, complicated problems we know are tangled and difficult problems, but they do have known solutions. For example, treating a burn or fixing a broken leg or something like that. There are procedures and there are best practice sets out there. Complex problems, by contrast, are totally different. Complex problems, by contrast, are totally different because they don't have any known solution and they don't have any single correct answer. For example, I think COVID-19 is a profound example of a complex problem that nurses are facing now and also in the future. These complex problems require that nursing leaders get comfortable with the tension of what I call A and D, and polarities, as they are inherent to real strategic problems. And the specific tension of and polarities offers an opportunity for innovative solutions. So a couple of examples here in terms of some real and polarities within the nursing profession. For example, how do nurses deal with prevention on the one hand and treatment? There's a real tension there. Also, technology and humanity, independence and collaboration, privacy and transparency. And another one is self-care and other care. I think this particular and polarity is one that many nurses struggle with, and one that begs for nursing leaders to engage in some strategic thinking on. During this COVID-19 pandemic, nurses around the world have been sacrificing themselves and dedicating themselves to patient care, often at the expense of their own care. And the consequences are monumental. Burnout, depression, psychological distress, physical distress, retention and recruitment problems within the professions are manifestations of this. And I think those responsible for nursing leadership development need to remember that essential workers are not just heroes, they're also human beings.
Thank you. And finally, could you give us a message to nurses and nursing students who are watching this video?
Sure. I think from a strategic thinking perspective, nursing as a profession is changing very rapidly, and nursing leadership development needs to keep up with the pace. This is a huge challenge with a lot of unknowns. Yet it presents opportunities for young leaders who are ambitious, bold, curious, and highly committed. So it's my special pleasure to have the opportunity to offer a couple of thoughts on nursing leadership development to you, the nurses, the frontline responders in our response to this pandemic. Thank you.